Hello everyone, good day. This is Princess Cassandra Pimentel, a nursing student of National University near Tildu. And for today's video, I am going to demonstrate the proper ways on how to assess the patient's mouth and oropharynx. So, the first thing you need to do is prepare the needed materials. So what we need are, of course, the patient's assessment chart and a pen. Then, a flashlight or a pen light, and of course a wooden tongue depressor, a 2x2 gauze pads, and lastly we also be needing an examination gloves and an alcohol for sanitary purposes. And after that, and before the assessment starts, make sure to perform an appropriate infection control procedures like performing a proper hand hygiene. Then, after that, you are now ready to assess the patient's mouth and oropharynx.
Come in.
Hello sir, good day. So, my name is Princess Cassandra and I am a student nurse. So, how are you today?
I feel good.
Okay, that's great. So, may I ask your name and your birthday, sir?
My name is Prince Daniel Pimentel.
Okay. And your birthday?
June 16, 2010.
Okay. So, can I check your wristband? Do you mind if I check your wristband to clarify identity, please? So, your name is Daniel Pimentel, check. Born on June 16, 2010, check. So, how can I refer you today? I mean, what do you want me to call you with?
BJ's fine.
Okay, BJ. So, another question. What language do you prefer to communicate with? Is it okay if I talk to you in straight English or Tagalog will do?
Tagalog in English.
Okay, Taglish. Okay, good. Sige po. So, before we start, let me just close this window to provide you some privacy. How about your position? Are you comfortable with your position right now?
Yes.
Okay, how about the room temperature? Do you want me to adjust it for you?
That's fine.
Okay, good. So, before we start, wait. Let me just ask you a few more questions. So, nakakaranas po ba kayo ng pananakit o pagsusugat sa inyong mouth or tongue sa dila po? Okay, how about redness, pamamaga, bleeding or pain po sa gums and sa mouth?
No.
Okay, that's great. Meron po ba kayong toothache? Pananakit sa ngipin?
No.
Okay, good. Hirap po sa paglunok or masakit po sa paglunok? Meron po ba? Nakakaranas po ba?
No.
Okay, good. Gaano po kayo kadalas mag-toothbrush sa isang araw?
3.
3 times a day? Okay, that's great, PJ. Do you floss or do you use mouthwash after you eat?
Yes.
That's great. Meron ka ba suot na pustiso or dentures ngayon?
No.
Okay. How about, ito, last na. When is your last visit to your dentist? I mean, kailan ka huling nagpa-tingin ng iyong ngipin? Last week ba? Last month? Or first time mo yun?
First time.
Okay. Thank you. Then, wait, let me just... So, I am here to assess your mouth and oropharynx. So, this is for us to know if there is any abnormalities regarding your mouth and oropharynx or there are no problems at all, okay?
Yes.
And this assessment will also give us the baseline data about the condition of your mouth and oropharynx. So, in case na, halimbawa, meron kang sakit sa bunganga, mga sugat, maaari natin siyang magamot kagad. So, during the conduct of the assessment, all I want you to do is follow all my instructions. Is that okay with you, BJ?
Yes.
Okay, good. So, let's start. And before we start pala, let me just put some hand gloves on. Okay, that's it. Sorry for the waiting. So, the first thing that I'm going to assess is your lips and your buccal mucosa. So, I'm going to assess first the outer lips. Can you purse your lips, sir? Okay, I'm going to check like you're going to zubo. Like, ganun ba? Okay, I'm going to check the color and the texture, and it looks fine. Okay, then I'm going to inspect and palpate your inner lips and your buccal mucosa. So I'm going to check the color, the moisture, the texture there, or is there any presence of lesion? Can you say ah or open your mouth? Ah. Okay. You don't mind if I touch your lips po, ano? Okay lang po? Okay, that's it. And then, let's go to your teeth and gums. So I'm going to inspect and also check the numbers of your teeth. Okay lang po ba yan?
Okay.
So, can you say ah again? So I'm going to check your teeth. Do you mind if I count them? Okay, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Can you tilt your head? 16, 17, 18, 19, 20, 21, 22, 23, 24. About your gums. Okay. That's a good texture. The moisture is good. The color is good. Okay, thank you. Then let's go to your tongue and the floor of your mouth. So I'm going to check the surface of your mouth and the tongue movement. So I want you to stick your tongue out. Can you do that for me? Okay? Okay. The texture is good, the moisture is good, no presence of lesion, and the color is good. Okay, thank you. And oh, I forgot. Can you push the roof of your mouth using your tongue, like this up? Okay, harder, please. Okay, that's good. Thank you. Then I'm going to check the floor of your mouth. Do you mind if I touch your tongue po? Using this gloves? Okay na? Pwede niyo po ba itas yung dila niyo? Like that. Okay, now check this. I'm sorry. Can I do that again? Okay. And wait. I'm just okay. Okay, that's it. And then let's go to your salivary glands and salivary duct. I'm just going to inspect it. Can you open your mouth again, sir? Okay, yes. Okay, okay na ba? Then after that, your polyps and the bula. So let me just check your hard and soft palate. So I'm going to check the color, the shape, and the texture a bit. Can you open your mouth again and tilt your head like that? Oh. Okay. Okay. Yes. Can you say ah? Wait, another one. Can you say ah again? Oh, okay. Thank you. And then let's go to your oropharynx and your tonsils. So I'm going to check the color and the texture of your oropharynx. I'm going to also check the gum reflex of yours, then your tonsil of yours. Is it okay with you?
Okay.
Okay. Okay, so can you open your mouth again? Wait. And another side. Okay. Then I'm going to check your gag reflex. So I'm going to press here. Oops! How are you feeling? Nasusuka po? Okay, let's say normal action. Okay, and for your tonsils, let me just, for the last time, open your mouth, sir. And, okay. And that's good. So, that's all for today, and that's it for your assessment of your mouth and your oropharynx. So, I'm just going to document all the findings, and upon checking your assessment BJ, I've found out that there are some abnormalities regarding your teeth. Kasi meron pong nakawala. Ang dapat kasi normal na bilang ng iyong teeth kapag bata is 28 and your teeth is 26 lang. Okay? Pero everything, except your teeth, everything seems normal na. And there's nothing to worry about, okay? So, wait, just fill up this form. So, let's wrap it all up, BJ. Thank you for your participation and your cooperation. I really appreciate that. So, if you need anything or you need me to do something for you, just don't hesitate to call me, okay?